Hello, everyone. Today, the topic that will be covered is ecological studies, and we have a very exciting guest. Today, I invited Dr. Taru Manyanga. He obtained his PhD from the School of Epidemiology and Public Health at the University of Ottawa, and he's currently in a career transition. So it's very exciting. Welcome, Taru, to our podcast.
Thank you very much, Dr. Lee. I'm glad to be part of the program and part of this class.
Awesome. So I gave my students a brief intro of who you are, but do you want to introduce yourself to the class?
Yeah, sure. Like what Eun-Young said, my name is Taru. I am a physiotherapist, so my first love is physiotherapy. I trained at the University of Manitoba in Winnipeg. After completing my physiotherapy degree, I worked different locations, first in private practice, then in hospitals. Eventually transitioned into research. I got interested in research because when I was working, I started seeing patients with metabolic conditions that were young, and there were a number of other factors. For example, there were questions that I had in physio that we did not necessarily have evidence for specific things we're doing. So it sort of drove me to research. So then I went to do my master's in community health sciences at the University of Manitoba. After completing the MSc, what you said, Young, I then moved to Ottawa, completed my PhD with Dr. Mark Tremblay, based at the Children's Hospital of Eastern Ontario. And my PhD was in epidemiology. I did a study in Mozambique, looking at lifestyle behaviors and weight status in kids between the ages of 9 and 11. Overall, that's my trajectory of training. Generally interested in being outdoors. I like to interact with people, so I love to engage students. I haven't had a great deal of time doing it, but when I have a chance like today, I think it's exciting to get to share some of my ideas, limited as they may be, but I think they may be also interesting to some of you. I think in a nutshell, that's me.
Awesome. Well, thanks for the really nice intro, and I really like having you to this interview, but I'm sure our students are also happy to have you, and they appreciate what you're gonna speak about ecological studies and also other things as well. So yes, very excited. So can you tell us, so you gave us a talk about your career transition, well, your trajectory so far and your kind of disciplinary training. And it sounds like you actually moved from practice into research. So it sounds like the opposite way than, people normally do, right? So you briefly said why you got interested in research. But can you expand a little bit why that was the case?
Yeah, so that's a very interesting trajectory for me, for sure. So when I was training as a physiotherapist, I was very curious about many questions. I asked a lot of questions to my professors, probably sometimes annoying them. And for some of your students, this may be very true. But so I asked a lot of questions, but then I was lucky, probably because one of my professors was doing research, and he invited me to be an assistant one summer.
Nice.
And so I was a research assistant in his wet lab. And so I got very curious about, what he was doing, the questions he was trying to answer. And so that sort of planted the seed. And so when I finished physiotherapy training and I was working initially in a private clinic, I started seeing young people, in early 20s or mid teens or even early mid 20s or something like that, who had significant body weight problems, metabolic syndrome, comorbidities like diabetes and stuff like that. And so I was curious why that was the case. And because the majority of these young patients were First Nations, patients, it drove me to think that the history of First Nations, many First Nations communities in Canada, is very similar to the history of our people. I grew up in Zimbabwe, which is a former British colony, and so as was the case in Canada, where indigenous populations were introduced to lifestyles and diets that were foreign to them a while ago. And then only after a period of time, we started seeing consequences of non-communicable diseases in their populations. I was curious because we were seeing the same thing in Zimbabwe. We were colonized in the 1890s, and when I was younger, I rarely ever, if ever, saw people with significant non-communicable diseases, but now it's sort of becoming more and more and more common. So naturally, I was like, okay, so why is this the case? I would look for literature, and so that was one part of it. The other part of it was just because I have a very curious mind. Sometimes I would ask myself, why do we do this technique? I mean, as kinesiology students will know, there are a lot of modalities that we use. So physio and kin are very similar. They are cousins, really. So you do some technique and you ask yourself, why do we do this? We do it because it works. Okay, it works, but is there evidence that this actually works, or is it a placebo effect? So a number of modalities that we use, although they work, there weren't really any significant body of literature that supported their use. So that was where my curiosity became more and more, and I was just sort of naturally driven to research that way.
That's very interesting, and you're right. There is very so physiotherapy and kin; those are really close programs. And actually, out of kin, lots of students pursue to become a physiotherapist. So I completely agree with that, and it is very interesting how you said that the introduction of new type of dietary habits and new lifestyles that could really impact human health, right? And one of your example, Indigenous Canadian, Indigenous people, the prevalence of diabetes is 3 times higher than the Canadian as a whole, right? So that's pretty striking, and that says something about what you said.
Yeah, and yeah, so that to me was like, oh my goodness, why is this? So you go into the literature and look at people that are studying these things, and you see that it is no coincidence, right? You get introduced to a lifestyle, you get introduced to a specific diet that is not, your genes have not interacted with these diets, and there's a lag, probably 50 years. I don't know the exact number, but there's a lag in when you start to see consequences of those things. And so because of that, myself, I was very curious. I was like, probably this is also the same that we see in most African countries that were former colonies of Western world or Western communities, where you see a lot of these conditions that were non-existent a few years ago, and now they are so prevalent. And you start to question yourself and ask your questions. So where are we heading? And unfortunately, for countries like my country of birth, we don't have a lot of resources to deal with these things, right? There's competing interests. There's other communicable diseases, unlike in Canada, where there's not a lot of communicable diseases. In Zimbabwe, there's a lot of communicable diseases, enteral diseases, and a lot of other things, right? So.
Right. So it's not just about non-communicable diseases, but it's about everything. So there's that, yeah. So there's that healthcare burden, but at the same time, there's not enough resources. So I guess
not a lot.
Yeah,
not a lot, unfortunately. Yeah.
So you said that in Zimbabwe and Mozambique, where you conducted some of your studies, what kind of non-communicable diseases are becoming more and more prevalent, would you say?
Yeah. So, for example, diabetes is becoming a big problem. Hypertension is becoming a big problem. Cardiovascular diseases, for example. Certain types of cancer. In Zimbabwe, for example, right now, there is an unbelievable uptick in colorectal cancer among young men. I mean, we are losing young men in their late 30s, early 40s. To me, this is like something very, very catastrophic and very scary, right? And the literature tells us, at least evidence shows, that some of these cancers are related to diet and lifestyle, especially insufficient physical activity, and so it's worrisome, and so you see people shifting, right? Because, for example, most of when I was in elementary school, I walked to school, I ran to school, that was natural and normal. The majority of kids do these sort of things, but now it's fashionable, it's more desirable, it's a class status to be able to be driven to school. So kids are much more interested in being driven to school. Most people have moved from rural areas to urban centers where there's so much population, there's so many cars, it's not walkable, right? So kids are being driven to school, and that reduces the amount of time they are spending physical activity. They're eating a lot of junk food, and the opposite of here, junk food is quite expensive over there. It's associated with wealth, so people want to eat it, right?
Nice.
So
Yeah.
it's sort of this oxymoron of these little things that we don't think about a lot, and obviously there are consequences to it.
Well, I just commented that it's nice, but actually it's not nice. So like, junk food chains like McDonald's will be considered as, high social class food.
Yeah, and it's very concerning. But to your credit, in these places in Mozambique and in Zimbabwe, I can't tell you how many people, professors included, I mean, people that know would be like, let's go to KFC, and I would say, no, I think let's cook. We have no, it's classy. Let's go to McDonald's, and let's go to, it's because if you are seen eating in McDonald's or seen eating in KFC, it's associated with class. And unfortunate bit is that people generally, where there's not enough resources, people are interested in showing off and I have enough food or something like that, and that's the unfortunate part of it.
Yeah. So, those lifestyle factors, so like behavioral risk factors really come into play, but at the same time, it's like the environment and, the introduction of new food and new industries getting into the country really makes it worse.
Oh yeah, without a doubt.
Yeah.
Industrialization has its benefits, but also has its demerits, right? Westernization is, in some ways very good because we can move from one place to the other. We can move goods from one place to the other in a very good way, but then it also has the unintended consequences of reducing habitual utilitarian physical activity, which is the most of what we do. Very, very rarely do you, except in major urban centers, do you have people exercising. Like exercising, it's something that we don't do in rural areas, right? People do that when they're doing chores. They go to the fields to farm, to till the land, fetch firewood, that sort of thing. But when you take that away and people are using cars instead of walking to schools, people are using these sedentary types of commuting, it takes away and it creates issues. So
Wow. Yeah, so just before getting into the ecological study design, which is the main topic for today's talk, but I just want to know what's going on with COVID-19 right now in Zimbabwe.
yeah, it's a scary situation because, like I said at the beginning, there is competing interests. So COVID is a big problem. We have significant cases and deaths. The unfortunate bit is because the surveillance mechanism and the tracing mechanisms are terrible at best. What is being reported certainly is underreporting. There's no equipment, there's no PPE, there's inadequate support to healthcare facilities. So, people can't access the hospitals. If they access the hospitals, there is not enough treatments. There is, no therapeutics and no preventative measures. And the biggest challenge is the economy is mostly informal. So when people are asked to stay home, like in a lockdown situation, they can't, because they have to go and sell tomatoes and or to get this and that, and there's no social safety nets. Right, in Canada, you can go and get a specific amount of money if you can't work because of COVID. There's nothing like that, so you have to survive.
Right.
If you have 5 kids and you can't go to work, you have to survive somehow. And so people break these lockdown, and so then they spread COVID. And the biggest conversation is, can I die today of hunger, or can I possibly die in 2 weeks of COVID? What is the choice, right? So it's a terrible situation. So it had the saving grace is that when COVID hit here, it wasn't as bad for a while. So these countries had a big, good start, but still it's not good enough. They don't have vaccines. They don't have. There's also a very significant problem of corruption and misuse of resources. So even when funds are allocated or donated, they don't necessarily go to where they're supposed to be going. And not to be political, but that's the reality of most of these places, unfortunately.
Yeah. Well, every single talk that I do, or almost all, become political. So that means that, when we talk about applications of epidemiology in public health, we talk about how political stance or political climate can really influence the decisions for public health and resource allocation. So you made really good point. And it's really even hard to hear, because with every disease, it doesn't matter, non-communicable, communicable. With COVID-19, for example, the reason why COVID-19 incident got a really steep increase in lower and middle income countries is because of the traveling. Those who are able to travel, they got into a different country where people are more isolated, and they spread the infection. And those countries are the hardest hit because they don't have resources. And it's not like countries who can individuals in the countries with enough resources, they provide resources there. It's right, because we are busy taking care of our own people. So it's very unfortunate.
Yes.
So okay, let's get into the business. So the ecological study design. So we talked about some of the issues, like health issues, at a global level, and there's a reason for that. So can you tell us what ecological study design is and what that entails?
Okay, so ecological studies really, if you think about the hierarchy of evidence, the higher you go, of course, is the pyramid or the triangle, whichever you want to prefer. The higher you go, the more weight you put on the evidence. Ecological studies are sort of at the base of the pyramid, sort of at the beginning of the pyramid. So they are studies that we use to collect data at a population level, right? So sometimes we don't have the access to individual data, or we don't have the luxury to do individual data. For example, in cases like, you want to know what is the effect of consuming this on the welfare of the country X, and you want to get data quickly, so you can make a lot of assumptions based on commercially available data. For example, you can prescribe and say, the economics of Canada, and you associate that to child welfare, for example, or some kind of health outcome. So when you're doing ecological studies, the unit of measurement is not the individual. It is a group or a population, right? So you may have data that were collected either as an administrative data or commercial data or whatever data, and then you are aggregating this data and using the group or a country or a village or a city as the unit of measure, and then and so you use that as the point of measurement. Of course, you can see how that can be a good thing, because if you want something quickly, it's cheap, it's inexpensive, these data are probably always already available, so you don't spend a lot of time looking for the data, or right. But the problem is there, you can't then attribute that data specifically to an individual, and we can go into detail a little bit later about what that problematic. But at the same time, because they are correlational studies, so you are making an association between a health outcome or something, or an outcome of interest, to some phenomena. Because they're correlational studies and you're using population or a group as the unit of measurement, the problem is we can't control for confounding variables, these variables that you have not measured or you were not able to control for. So that is one of the bigger problem. So that's one of, in a nutshell, that's what ecological studies are. There are advantages and disadvantages which we can get into as we go along.
Wow, that's a really great description, and so many important points are already made. So students are already being introduced to the hierarchy of evidence, and also confounding, the concepts of confounding and potential bias, causation versus association versus correlation. So I think it's going to be a nice transition, and actually your what you just spoke will really help them to understand. So I guess an example of ecological study design is then, for example, looking at alcohol consumption by country.
Yes.
So let's say in Canada, 20% of individuals consume alcohol every day. This is not based on any data. Yeah. And in Zimbabwe, 10% of people consume alcohol every day. So then that will be the unit of measurement will be at the country level.
Yes.
I see.
Yes. So that's so you can use the country based on the data that are available at a very macro level, right? 20% of Canadians drink alcohol every day. 15% of Zimbabweans drink alcohol every day. 5% of English people drink alcohol every day. 2% of
no way,
Australians.
Taru. English people would drink like way more.
Okay, I did that on purpose. But the point I wanted to make is, we can look at the data and say, oh yeah, generally this is the trend. We can see some sort of idea, but it can be misleading in the sense that there could be specific individuals that are really, really, really.
Right. So based on that data, me making assumption, oh, English people don't drink, I shouldn't ask them to go for beer.
Yes,
yes. That'll be a wrong.
That will be wrong assumption. Yeah.
Okay.
So the issue of the problem with ecological studies specifically is this issue of something called the ecological fallacy, which I think some students might have heard. It's where you can't attribute a phenomena that you observe at a population level to an individual, because you have not observed that for cause and effect to happen, both the exposure and the outcome have to happen in the individual, right? You have to observe it at the individual level.
Right.
If we're saying 20% of Canadians drink alcohol, or if we're saying, for example, health-related quality of life in Canada is associated with, well, not in Canada, health-related quality of life is associated with the country's level of income or human development index, right? We have made that assumption based on the population level.
Right.
The challenge is individual health-related quality of life has not been measured at an individual level. So we can't attribute the fact that because Canada in general has a high income or high HDI, and generally the people on average say they are happier or their health quality of life is better. That can't be for everybody.
Right. So we cannot make assumption based on ecological data that all Canadians are happier.
Yes.
Or they show better quality of life than anyone else in the world.
Yeah, exactly. That's exactly the point. So we have to be a bit careful when we're using ecological study data, mostly because it's correlational. It has not been, confounding factors can be there. There is a significant risk of the ecological fallacy, and we can't also, because there's no data at individual levels, we can't ascribe causation, right? So there is no direct effect in causation. We can just make associations at a higher level. And although this is a good study because it can be hypothesis generating, right? If
what
we
does
want to
that mean?
That means that if you have, you want to find out if something makes sense, right? You have an idea that this could be, you just want to see what may be the reason why something is happening. And so you do an ecological study, you figure out that there is some association between, like we were saying, health-related quality of life and country's economic status. So then you have an hypothesis. Okay, is it real that if a country has a high HDI, generally people have a higher quality of life? That's a hypothesis based on the global data that you have. And then you can then do specific studies to either prove or disprove that hypothesis, that assertion, so to speak, or that idea, or that,
Yeah. So then I guess building on that ecological evidence, we can actually collect data from individuals to confirm or reject the hypothesis that we tested using ecological studies.
Fantastic. Yeah. So it helps us as researchers. It helps us to develop targeted questions, right? It gives us, so instead of just, you and me deciding, let's just go and look for this question, right? Go fishing. We can spend a lot of time fishing for questions. If we did an ecological study, it will sort of almost like give us a roadmap. This is something that is there. I know we will talk about Global Metrics initiative later on, but the study that I was involved in, which is an ecological study, we generated a lot of possible hypotheses or questions that then specific researchers can go and examine, right, and get more data on.
Yeah. So just to summarize about weaknesses and strength of ecological study design. So advantages that include that we can generate hypotheses and it can create kind of a research roadmap in terms of which approach we can take or which assumption we can test or it's valuable to test. And also we can develop, so it's similar to that point, we can develop targeted questions and we can just do some kind of exploration. Of course, we are not fishing around, but we can conduct on certain exploratory research and see if we can get something interesting out of that we can continue to researching using different study designs.
Yes, and also adding on to that, another advantage is that it's very cheap and easy to conduct.
Right.
So, where in places where there are no resources, this is a very easy way of getting data that can be useful. So if you don't have a lot of research money, you can do an ecological studies. It helps you to generate some ideas of what questions are important to ask. Then you can use your smaller resources to target whatever information or assumptions or assertions you have made based on ecological data.
Right, and global organizations such as the United Nations, World Health Organization, World Bank, they provide lots of data,
Yes.
and those are publicly available. So that's a really good point. So cheap and easy, so convenience associated with conducting ecological study. And some of the disadvantages include that we cannot infer causation because the data that we have is correlational. and the unit of measurement is at the population level, not at the individual level. So we cannot make assumptions based on the data that we have or based on the result. So we have to make sure that we don't commit ecological fallacy.
Yeah.
And also we are not able to control for confounding factors.
Yeah.
So, we covered confounding factors. So, but what are the examples of confounding factors?
In generally, a confounding factor is a factor that could have an influence or could affect the relationship between A and B, but you haven't really accounted for it when you're doing a study, right?
Mm-hmm.
An example could be that we are looking at ecological data at a population level, but certain individuals have specific characteristics that may make them more susceptible to something. An example could be if age was a factor that could influence a certain behavior, and we don't have data on the ages of people that we are making an assumption about, that could be a confounding issue, right? There are other factors that are characteristics of people that we would want to control for if we were collecting data at an individual level.
Right.
So that when we know, as an example, if we want to check health related, quality of life, we are not making assumptions without knowing that the people that are in this study or the population that we are, discussing, maybe there are people that have depressive symptoms. Maybe there are people that have that generally sort of self-selecting, people that like to do physical activity or that like to do, you know what I mean? If we don't know that because we didn't collect this data at an individual level, but we're making assumptions at a group level, those factors that are individual can be confounding.
Right. So basically, because we are not controlling all the available, and of course, it is impossible to control for all available confounding variables in research. But when we are not even able to control just one confounder, then the result that we produce is likely have a higher chance to have an error.
Yes.
Yeah. Okay.
Yeah.
Okay, that's very good to know. So strengths and weaknesses of ecological study design covered. So let's get on to the example of ecological studies. So you mentioned the global matrix. So can you explain what the project was about and how ecological study design was used for the project?
Okay, great. So there is an initiative called the Global Matrix. There's an organization called Active Healthy Kids Global Alliance, which is an organization of researchers and academics around the world, led by Marc Tremblay from Ottawa and a number of leading scientists, and luckily yourself is involved in this project. Yes, I am also involved. So what happens is countries that are interested join. Generally, the idea is to look at indicators of physical activity among kids and adolescents in countries that are participating. So these indicators, they are specifically selected, based on their relationship, or at least the idea that we know that they are, we can look at them as a measure of how active or inactive kids are around the world. And so the project has been going on since 2014, when only 15 countries, I believe there were, that met in Toronto and developed what is called a report card. And what that is just a report based on data from each country about physical activity. So we collect data, we collect studies in a specific country that report on specific indicators of activity. For example, overall physical activity, participation in sports, amount of time kids are sitting down, active transportation, so use of active transportation, etc., etc. So there are lifestyle behaviors, but there are also influencers of lifestyle behaviors. Sources of influence could be family and peers. It could be community environment. It could be the school environment. could also be policies that are designed by government to either facilitate physical activity, right? So these report cards are designed to have a systematic way of gathering data. So every country that joins to participate, so there's been 3 that have been done. We are at the moment in the process of starting the 4th one. So these countries develop these report cards. The indicators, like I said, are developed after consultation with scientists and academics around the world. The last time there were 10 indicators of physical activity that were selected, 5 lifestyle behaviors, 4 lifestyle behaviors, 4 sources of influence, and physical fitness, right? And so when we do these projects, we then gather data, country-specific data. Each country produces a report card that's based on data from that country. So that was the process of developing that report card is like data synthesis, basically. Some countries use systematic reviews, some countries use narrative reviews, but it's a basic combination of hand searching, searching great literature, systematic way of finding data. Whatever data you have about these indicators, you use it to grade each indicator. And so the grades are from A to F, A being, you're doing very well, and the A can be assigned a percentage, right? So if, for example, the prevalence of sedentary behavior is 80% in kids, so then the grade for sedentary behavior is, it's a bad grade. So I used a wrong example.
Yeah.
If active transportation, if 80% of the kids in a country are using active transportation, so they get an A in active transportation. If only 50% are overall physically active, they get a C in active transportation. If the majority of kids are spending more than 2 hours watching TV, so they get a failing grade on sedentary behavior, something like that. And that's how, yeah.
So just to summarize, Global Matrix is a comprehensive kind of evaluation of physical activity and also physical activity related measures. So that includes 5 different physical activity related lifestyle factors and the other 5 on influences, so about the environment. And I guess each country collects their own data on each indicator. So that could be based on individual level data. Then what we do as a group, so as a global matrix group, we collect country specific data and we aggregate them and we create ecological data and we do analysis.
Exactly. So here comes the example of how these data are used. Once each country has collected data, Zimbabwe, Canada, US, Brazil, the last one, there were 49 countries. Once all of these countries have collected data, we then say, okay, are there patterns? Can we make any sense of this data? Is there some pattern of something that we can use as researchers to figure out something that is happening that's common among all these kids? So the paper that we're discussing today, we grouped these countries into using one common thing. We use the Human Development Index. So we then decided, okay, let's see, for all the participating countries, let's see if we group countries that are lower to middle income countries, right? And then countries that are higher middle income countries, and then countries that are very, very high HDDI, right? Can we find something common? So we grouped, in our case, in the paper that I'm talking about, there were 9 countries, 6 from Sub-Saharan Africa and 3 from Asia, whose HDI or Human Development Index fell into this category that we were interested in. And once we had those report cards, we then grouped their report cards using each indicator. So we would say, let's look at active transportation. What grade was it in Zimbabwe? What grade was it in Botswana? What grade was it in Bangladesh? So we converted the grades into interval data, and then we use that interval data to run correlation matrices. And we were able to look at, was physical activity related to, as an example, the Gini coefficient, or was physical activity related to Human Development Index, or so the different kind of country specific measures. Okay? And so that's ecological data, because we are using a report that has been developed from each country. Even at the country level, it's not individual data. They are taking studies so these studies may be on individual data, but these studies have now been synthesized into a report.
Right.
And then we take that report that could include 20 studies, as an example. Maybe in Zimbabwe, there were 20 studies that produced a report card. In Bangladesh, maybe there were 15 studies that produced a report card. In India, they probably had 50 studies. And then we're taking that report card to combine it into one manuscript based on 9 countries.
Right.
And so the unit of measure there is no longer the individual, not even it's the country itself, right?
Right. Well, yeah, so looping back to what we discussed in the earlier conversation, so ecological studies, it produces population level data, and it could, like global matrix, it's based on the individual data, but because now after gathering all the data from different countries, we are using the country level data, so that becomes ecological studies. And also it makes sense that this ecological study, especially global matrix initiatives, it's really good for hypothesis generating.
Yes.
Because based on Human Development Index, we divide the countries into 3 different groups: low to middle, high, and very high. And we were looking at things in more detail. Okay, what's going on in this low and middle HDI index countries? What's going on here? Let's see. And why their physical activity is high, and whereas in very high income countries, physical activity is low, but there's more infrastructure. And in low and middle income countries, there's not enough infrastructure, but kids are active. Like, what's going on? So that makes total sense.
Yes. Yeah. And so it was exactly that we were interested in looking at countries that could have a lot of things in common. So we deliberately made these countries more homogeneous. And interestingly enough, doing that actually showed a lot of interesting patterns, right? So in countries with low to middle income, in middle HDIs, we found that their sources of infrastructure was terrible. They had terrible grades for policies. They had bad grades for communities and environments that were not as supportive. But on the other hand, their lifestyle behaviors were very good. They were active. They used active transportation. They were not as sedentary. They participated. They were physically fit. And so, what you could gather from that is the fact that even if it's more desirable to have good infrastructure, it doesn't necessarily mean if you build it, they will come, right? And sort of converse to that, it doesn't mean that where there's nothing, kids won't play or kids won't be active. It just means in some cases it's necessary for these kids to walk because that's the only means of transportation.
Right.
Or kids are playing outside because they don't have recreational facilities that they could use, so they're playing outside, and that becomes an activity on its own.
So in terms of future implications based on the kind of study, in low and middle income countries, because walking is the only way the kids can move around, but as with industrialization and urbanization, we cannot go backwards, right? So there will be more infrastructure and there will be more cars, etc. So what can we do to keep the activity level at the higher level? Like Western countries, we are apparently failing to keep our kids active, and the resources we have do not really work. So what do you say about that?
So I think this is a very good point, very, very good and important question. We in lower income countries are learning the wrong lessons. And this is the scary part, because we are learning the bad habits that Western countries or developed countries or high income countries have learned. we are learning that sitting more is desirable, which is not. Walking less is desirable, which it is not. And so at a policy level, what these data are telling us is that although we are still doing well in low income countries, we are heading towards the wrong direction. So this is the time to correct it, right? So countries can look at this data and say, huh, you know what? We are doing better, but not that great. So why don't we preserve these behaviors that we have and celebrate them as part of our heritage? So instead of getting kids to think that it's more desirable to take a bus or to go on a car, why don't we promote active transportation? You know, instead of video games and smartphones for every child, why don't we explain to kids that there are traditional games outside, playing with their, you know, with each other outside is actually more desirable, and maintaining the idea that when they go to do their chores, it's actually more desirable than. So at a policy level, that to me is the implication of it. Secondarily, we can use this data and go specifically to countries that are in similar. What we found, for example, was that there were very common patterns of things that were happening that were good, but also things that were not good. So we could use, instead of this being a problem for Zimbabwe, for example, if I went to the politicians in Zimbabwe and said, you know what, our policies suck, you guys need to do better, it can be an issue for me. But if I went there and I said to them, you know what, there's something common between Zimbabwe and Bangladesh and India. It is the fact that our policies for physical activity suck. So all of a sudden, they are no longer as defensive, right? They can identify with another country, and they don't look at it as, you know, you are pointing a finger at us, and so you're accusing us. They look at it as, what is the opportunity for us to get better, right?
Right. So that framing, when you interpret or convey the research results, is really important, especially when approaching country leaders or policymakers who have big egos.
Yes.
Potentially. Yeah. Okay. So from a different angle, what can we do in very high income countries? What can we do? Because it seems like we have really good resources, safe space for play, and we have good urban planning, but still kids are not active. Like but we cannot really get rid of all those things and see what happens, right? So what can we do in very high income countries then?
Yeah, so the advantage of doing, so I go back again to the advantages of this ecological data, that because it includes countries from low income countries which are doing well in these lifestyle behaviors, high income countries can learn, right? What are these things? Why are these countries doing so well? Well, one of the things is that generally in low income countries, kids have independent mobility. They get out and they walk around, they go to school. You won't see a parent walking with a 10-year-old going to school. They are with their friends. They walk to school, they come back to school. So, and I know this is a bit controversial, but I think one way is to allow kids to be kids. Let kids play. Don't ban tag, as what happened somewhere in some city that I won't mention by name. Don't ban things that are encouraging kids to be outside, to play, to do. Yes, safety is important. Yes, it's important to be careful, but risky play is part of childhood. Allow kids to be kids. But also at the same time, instead of policymakers being reflexively defensive, if we present this data and say, look at kids in Zimbabwe, look at kids in Mozambique, look at kids in China, or in not China, because China was not part of this group, Bangladesh, India, and Nepal. They are out, they are active. Can't we use that and see some change? So we can pilot, allow a certain community to have kids do kids things, walk to school, or drive kids and leave them, drop off point, and walk with them to school and see if that changes, right? So from that point of view, I think high income countries can learn. The other thing, quickly, is that it doesn't necessarily mean that when we build infrastructure, kids will come. The infrastructure has to be built with the idea that it may help, but it will not solve this problem forever.
Right.
We have to do a wholesale
Yeah.
change in the
Uh-huh.
thinking.
So physical environment is really important, but changing the social cultural environment where safety is the best and keeping kids inside is the best way to raise our children in a safe environment. All those things, of course, it's more complicated than, we can make just one clean statement, but just let the kids to be kids and let them
Exactly.
play.
Exactly.
Yeah, and the rest is our adults' job to ensure that they're in a safe environment, but they have some independency and autonomy.
Yes.
Yeah, that's awesome. Well, thanks for a really important message, and I think we learned a lot about ecological study design. So I I think it's a good time to end this interview. But before we do that, do you have any advice to our students at Queen's?
Well, the only thing I would say is that because I talk too much, I'll try and be very brief.
Oh, no
I
worries.
think what I would say is enjoy what you're doing, learn. You never know what you would want to do. This course that you're taking, I think, is very important because it introduces you to epidemiology and to public health, and so learn, but do as much as you can to also enjoy the learning process. For people like me who have started and unconventionally so started as a physiotherapist, went into research, got a postdoctoral fellowship, declined it, went back to practice physiotherapy, and now transitioning into an academic position, although very unorthodox, if that is your path, don't let anybody discourage you from pursuing it because not everybody is going to take the cookie cutter road. So as kinesiology students, the most of you may be thinking, I want to go to physio school, I want to go to medical school, I want to do. If that's not for you, if research is where your heart is, follow it. You know, if completely unrelated program is what you think is good, do it and follow it. Follow your heart, ask questions, and don't be afraid to fail. It's only through failure that we learn the best.
Wow, thanks for the advice. That helps me too. Don't be afraid to fail.
Yes.
Okay, well, thanks so much, Dr. Manyanga, for really nice talk. I really enjoyed it. So thank you for coming in today.
Thank you very much and have the best.